Well, shortage of medical staff, ineffective screening process, lack of permanent leadership. These are some of the findings from a federal inspection into the Lompoc Federal Prison's response to the COVID-19 outbreak. We reviewed that report and broke down the results from the Department of Justice's report. Lompoc Federal Prison hit hard by the coronavirus. As of May 11th, more than 75% of inmates and 18% of staff tested positive for COVID-19. That's according to an inspection by the Department of Justice. From April 23rd to May 1st, federal officials looked into prisons' responses to the pandemic and whether or not Lompoc Prison followed CDC guidelines. The Office of the Inspector General found an insufficient number of correctional staff members, delayed modified operations, a lack of permanent leadership, an ineffective screening process of employees and inmates, and a need for more PPE and face coverings. They say the biggest challenge in preventing the spread of the virus was a pre-existing shortage of medical staff. In response, a spokesperson for the Federal Bureau of Prisons says 40 additional medical staff and 131 additional staff were deployed after identifying the outbreak. And as far as leadership goes, the BOP says every acting complex warden had more than 20 years of correctional experience. They also added that face coverings were more widely used following CDC guidelines, and bed capacity was expanded to allow for better isolation. In a statement, BOP officials said these findings must be placed in context, as these were unique circumstances where the BOP, along with the rest of the country, was learning about how to treat and manage the novel virus.